Our overall clinical experience with Captopril, which is now in more than 120 patients, have shown that Captopril is very well tolerated.
As we have used it more, we have come to rely upon it as a good, effective antihypertensive agent.
When patients were taking Captopril, they were feeling really well.
The adverse effects were really quite few.
Salzburg, Austria was the locale for a recent international symposium on Captopril, the first of a new therapeutic class of antihypertensive agents. Because of its unique and selective mode of action in suppressing the renin-angiotensin-aldosterone system, Captopril lowers blood pressure safely and effectively. Several participants in the symposium were interviewed about Captopril. This film presents their experience and recommendations concerning the many types of patients who are suitable candidates for Captopril therapy, the optimal method of initiating therapy, and the safety and therapeutic results that may be anticipated. Captopril finds wide use in the therapy of hypertension. It is indicated for the treatment of patients with all types of the disease and all grades, from mild to severe.
If we look at clinical studies that we have undertaken using Captopril, we gave Captopril to several kinds of hypertensive patients. Let's say essential hypertensives, renovascular hypertensives, and patients with hypertension associated with chronic renal failure.
In Sweden, Captopril has been released for use in patients with therapy-resistant hypertension. That is, those has been on standard triple therapy with a diuretic, a beta blocker, and a vasodilator in optimum doses. And of course, I think you can use Captopril in these cases, substituting the beta blocker and the vasodilator with the Captopril, and have them on the combination with the diuretic. We have experience with Captopril in more mild to moderate essential hypertension, and I think it works quite effectively even in these patients.
Dr. Matterson presented a report at the Salzburg Symposium on a recently completed study of low-dose Captopril alone and with a diuretic conducted by the Veterans Administration Cooperative Study Group on Antihypertensive Agents.
At the time we designed this study, Captopril was available largely for patients who had very severe hypertension. These were people generally quite ill. They might have diseases such as systemic lupus erythematosus or scleroderma, and we wanted to find out whether or not we might be able to use it in much lower doses and perhaps get a much better benefit to safety ratio.
The study involved more than 700 patients and revealed that Captopril may safely and effectively be used in patients with milder degrees of hypertension.
I think it's important to recognize that one of the conclusions that we made from our VA cooperative study was that perhaps the original admonition against using Captopril in mild to moderate patients need not be true and need not be adhered to. And we now believe, and I'm obviously doing this with my private patients, that we can use Captopril in our mild to moderately hypertensive patients.
Captopril effectively lowers blood pressure in a large proportion of hypertensive patients when used as single drug therapy. However, it may be used in combination with other antihypertensive agents, especially thiazide-type diuretics.
In the majority of cases, and that would be a substantial number, Captopril will be most effective if given with a diuretic or with a low-salt diet. A diuretic being one effective agent in everyday practice. So the physician might want to decide, depending on the emergency or the urgency of therapy, upon the clinical characteristic of the patient, upon the circumstances under which he is working, whether he should begin captopril alone and later on add a diuretic as required, or whether he would like to add captopril cautiously to a patient who is already taking a diuretic agent.
In about half of the patients we had to add a diuretic. We used hydrochlorothiazide in doses between 25 and 100 milligram. And on the combined treatment with the captopril and the diuretic, all patients responded very favorably, and all of them became normotensive. That is, that they achieved a blood pressure below 140 through 90 millimeter of mercury.
As we showed in our VA cooperative study, captopril benefits tremendously by the addition of a diuretic drug. Now, that does not mean that it could not be used alone, because we also demonstrated that was true in a large number of patients. However, the potentiation by the diuretic is quite dramatic and is something that the clinician can take advantage of when he needs to.
We have some patients who has not responded to the so-called standard triple therapy, where we have withdrawn the beta blocker and the vasodilator, and then substituted these two agents with captopril. And in these ongoing studies, now amounting about 20 to 30 patients, we have found that when the patient who's then on a beta block or on a diuretic in a rather high dose, when we then add the captopril, we have a satisfactory blood pressure response in most of these patients.
Captopril is effective in a simple, low-dosage schedule.
As far as the dose is concerned, all studies were done as proposed by the manufacturer. We started with 25 milligram TID. Then we increased the dose every 2 weeks to a maximum of 150 TID. In fact, I should say here that we went to 150 TID only one time in about 100 patients now that were given captopril.
Dr. Mimron's study determined that an established dose of captopril which is effective for a patient can often be lowered without a loss of efficacy.
In fact, I should say that this study was interesting was very interesting for us, since we found out that we could, and in fact we should, reassess the need for captopril dose in patients who have been controlled for quite a reasonable amount of time. This also is an important point, since if we could reduce dosage after an average control time of hypertension of, let's say, 7 to 8 months in patients who in fact have to be treated for a very long period of time, we could also reduce the cost of treatment.
Captopril can cause an initial hypotensive response. In general, one can predict this fairly well. These are the patients who are taking diuretic drugs or who are taking large quantities of other drugs. For example, the severely ill patient who comes in already treated with diuretic plus many other drugs, and to whom captopril is then added. The second group of patient is that patient who's already volume depleted. For example, people who have been on fairly severe salt-restricted diets. And a third group might be the group of patients who are baseline high renin activity patients, and for whom the renin underpinning, so to speak, is cut right out from under them by the potent action of captopril. So in general, one can anticipate when this is going to happen.
Captopril has a mild side effects profile and is safe because its selective action is specifically directed to the renin-angiotensin system. It is well tolerated, and many patients report a sense of well-being while on captopril therapy.
But the basic message is that patients seem to feel quite well. They don't get lethargy, they don't have muscle cramps, they don't feel terribly tired, they don't have sleep pattern disturbances, they don't get nightmares, they don't, as far as we can tell, they don't get sexual dysfunction. So we've been very pleased because our patients have been very pleased.
Our overall clinical experience with Captopril, which is now in more than 120 patients, have shown that Captopril is very well tolerated. We have had some of the known side effects. We have had 3 cases of taste loss, 4 cases with rash, but both of these side effects subsided on continuing treatment with Captopril in a reduced dose. There seems to be a difference between Captopril and other commonly used antihypertensives regarding the patient's experience with the drug. Many patients spontaneously report a sense of well-being when treated with Captopril, especially those who have been exposed to other drugs, for instance, beta blockers. They seldom complain of tiredness or dizziness, and I have never had any case of stomach or discomfort of that kind, which may be rather common with other drugs.
Whenever there is a need to stop the Captopril therapy, I think it's one of the easiest drugs in the world to discontinue. You just stop it. It's not very common for a physician to afford being dogmatic. There are so many exceptions in medicine. But that's one of those rare occasions when one can say that neither in our center nor elsewhere that I've heard of has there ever been a rebound phenomenon, by which I mean a sudden rise of blood pressure to levels higher than what they were initially when Captopril was stopped, whether the patient continued to take a diuretic or was not on any other concomitant medication.
Besides the fair control of hypertension in these patients by Captopril, we observed that there was no tachycardia associated with the fall in blood pressure, as this quite bothering sign is observed with other vasodilators.
The confidence that has developed in the safety of Captopril among clinical investigators extends also to the agent's efficacy.
And what was impressive with Captopril has been its consistency. I think now, with a number of years, it has been used from many centers throughout the world. There is developing a certain consensus about its efficacy. We all know the kind of halo that surrounds new drugs as they are introduced. At first, they work very well and everyone is enthusiastic, and then as time goes by, this halo pales a little bit. It has not been this did not occur. It has not been the case with Captopril. As we have used it more, we have come to rely upon it as a good, effective antihypertensive agent.
Yes, Captopril is an extremely effective antihypertensive drug. We have not, of course, compared it head-to-head with central nervous system depressing drugs, or with the beta adrenergic blocking agents or alpha adrenergic blocking agents. But the impression that I get is that when used alone, it is at least as effective and perhaps more effective than the other drugs. And when used with diuretic, again, is at least as effective and probably, in many cases, much more effective for the doses that we're using. In other words, we're able to use very small doses with diuretic and get a rather satisfactory decline in blood pressure.
I do not believe personally that Captopril has a euphoric effect. It's not a euphoriant drug. In our experience, basically, patients whose blood pressure was controlled at the expense of a lot of side effects, sometimes even subliminal side effects, a slight slowing of mentation or maybe some problem with rapid standing up, suddenly has his blood pressure controlled as well, if not better, without any side effect to speak of.
We have been very satisfied with the hypotensive effect of the drug.
But the basic message is that patients seem to feel quite well.
When patients were taking Captopril, they were feeling really well.